So good morning and welcome to the 5th Annual New South Wales Brain Tumour Support and Education Forum, which is occurring as part of the Brain Cancer Action Week, which started on Sunday. My name is Professor Sanchia Aranda. I'm the Deputy CEO at the Cancer Institute New South Wales, and it's the Institute's pleasure, along with the New South Wales Oncology Group for Neuro-Oncology, it's our pleasure to host this forum this year. And it's my absolute pleasure to officially open it and welcome you here. The forum is an initiative of the New South Wales Oncology Group for Neuro-Oncology, and I'd particularly like to thank the group, and in particular its chair and today's facilitator, Dr. Kerry McDonald, who's sitting down the front here, for their work and dedication in bringing you once again, what looks like an excellent program of work. So well done, Kerry and your team. I'd also like to welcome our keynote speaker from St Francis Medical Group in Connecticut, USA, Dr. James Redenberg. James is sitting at the front, and we're delighted that you could join us today, and I'm sure that James's contribution will be very memorable. I'd also like to apologise in advance for having to run away from today's event almost as soon as I've got here, but there's a competing cancer and lung cancer at the airport today, and I'm participating in that, and it's important to see that some of perhaps our neglected cancers in terms of brain cancer and lung cancer are getting some attention today, and hopefully much more attention into the future. It's also my pleasure now to introduce Associate Professor Brian Owler, who will be providing today's welcome address. Professor Owler is Consultant Neurosurgeon at the Children's Hospital at Westmead and at a number of private hospitals across Sydney. He must spend a lot of time in his car running backwards and forwards. Professor Owler has a PhD from the University of Sydney and gained postdoctoral research experience at the Academic Neurosurgery Unit at the University of Cambridge. In 2012, Professor Owler was elected as the President of the Australian Medical Association for New South Wales, and he is a tireless campaigner for safety in our communities. He's worked with Roads and Maritime Service to develop the Don't Rush campaign, targeted at reducing speed-related road accidents in New South Wales. He's been on the receiving end, I'm sure, of the road accident outcomes, and that really does sharpen your mind for some of the prevention activities. He's also dedicated to the reduction of preventable deaths from areas like, for children in areas like pool safety and falls from residential buildings. So please welcome Professor Owler to provide the welcome address, and I do hope that you have an extraordinarily good day. Thank you.
Well, thank you very much. Good morning, everyone. I have tweeted already, you'll be pleased to know. It is an honour and a pleasure to be asked to introduce the 5th Brain Tumour Research and Education Forum. This is, of course, an excellent initiative of the Cancer Institute of New South Wales, and it's been organised, as noted, through the New South Wales Oncology Group, and particularly Dr. Kerry McDonald, so well done. I'd like to welcome our international guest, Professor Vredenberg, from the St Francis Medical Group in Connecticut, where he's Director of Clinical Research. He's a neuro-oncologist, and he's supported by Roche Pharmaceuticals. We are grateful that you've been able to join us here in Sydney, and very much looking forward to hearing what you have to say, and I hope you very much enjoy your time with us here in Sydney. I'd also like to now welcome the many patients that are here today, along with their families and friends and carers. This forum is really about you, and I truly hope that you find today's forum informative, and that you come away that there is a sense that there are many professionals committed to improving the outcomes for patients. To those professionals that are here today, thank you for attending and contributing to today's sessions. The organisers, as I mentioned, put together a great program. Now, as said in the introduction, I'm an adult and paediatric neurosurgeon, and I'm also president of the New South Wales AMA, and today gives me an opportunity to talk from both perspectives, that is, as a doctor looking after patients with brain tumours, but also as AMA president and representing the profession. So yesterday I met up with a patient of mine, Deborah, and her husband, and I removed a glioblastoma from Deborah's brain, and we've been meeting every 3 months since then with a new MRI scan. And yesterday was the same, no change, no evidence of tumour recurrence. Nothing exciting. But as a neurosurgeon, nothing exciting is exciting. We like that. I'm sure Deborah feels exactly the same way. Now, the remarkable thing about Deborah, and for me and to me, really, is that it's now almost 5 years. In fact, in August, it'll be 5 years since she had her glioblastoma removed. And I think that's an important message. My colleagues will all tell you the frustrations that neurosurgeons, oncologists and researchers have experienced in the lack of progress and treatment of particular brain tumours, and especially glioblastoma, which is unfortunately the most common intrinsic primary brain tumour in adults. However, when we look back within the last 10 years, we have seen significant advances. Our surgery, for instance, has become more accurate and in some cases less invasive. The use of computer image guidance during brain surgery has now become standard. Now, I'm not that old, but when I first started, it wasn't available at all, and I still remember the first units that were brought in, wires running all over the place. Intraoperative imaging, such as MRI, has obvious advantages, but it's still very expensive, and as such, its availability is still very limited, and that's something that frustrates me as a paediatric neurosurgeon, where degree of resection is very much linked to survival and outcome. Radiotherapy, particularly in relation to planning and dose delivery, has become more accurate and advanced. But I think the biggest change that we've seen, in relation to gliomas at least, has been the introduction, of course, of concurrent radiotherapy and chemotherapy with temozolomide. There have been noticeable improvements to clinicians in terms of survival of patients with gliomas, and particularly in the small number of long-term survivors such as Deborah. Now, they're small but really important improvements. I think it's really important to remind ourselves, as well as our politicians, that there are success stories when it comes to brain tumour research and treatment. When we look at medulloblastoma, which is a common malignant brain tumour that occurs in children, and in fact the commonest malignant brain tumour in children, and remember, brain tumours are the most common solid tumour in children. Previously, when patients presented with a medulloblastoma, it was uniformly fatal. Today, if the child is over 3 years of age, does not have dissemination at the time of diagnosis and has a good surgical resection, the survival rate can be over 80%. So the dramatic improvements that we have seen for some tumours, such as medulloblastoma, have come through hard work of researchers on an international basis, researchers like those in this room today, Professor Vredenberg and others from around the country. There are many centres of excellence for brain tumour research, such as the Lowy Cancer Research Centre with Kerry MacDonald. I know Professor David Walker's here today from the Queensland Institute for Medical Research, and there are many other centres of excellence that we can point to. And I think we can be very proud of the quality of research conducted in this country. It's important that we continue to invest in medical research in Australia. In a tight fiscal climate, we need to be vigilant to ensure that funding is preserved and, of course, advocate for more support and funding for brain tumour research. I think we all have the feeling that we're on the cusp of a breakthrough. Something's just over the horizon, and there are many exciting areas of research: tumour vaccines and immunotherapies, molecular therapies, new designer drugs, and the opportunity to tailor treatment based on a patient's tumour's genetic profile. And we're going to hear a lot more about those areas today. Now, another reason for continued improvement in patient care within Australia is our fortune in having highly trained doctors, nurses and allied health professionals. Now, we're going to hear from some of those today, such as neurosurgeons Dr. Brenda Shivalingam, Dr. Jacob Fairhill, radiation oncologist Professor Michael Back, and someone who I turn to for the hard cases, as far as chemotherapy is concerned, Dr. Helen Wheeler. Now, it's certainly an honour for me, as an AMA President, to represent the profession with colleagues such as these and many others. So this forum is to be patient-centred, and today's program provides an opportunity to learn about the role of rehabilitation and physiotherapy and to answer questions that many patients have about complementary therapies. There are sessions on the implications for driving as well as legal and financial issues, and we recognise that for many patients these are important issues that impact on their daily lives and are a source of anxiety, and I'm sure that these will be popular sessions. Finally, the reason that I mentioned Deborah's story at the start, and I'm sure my colleagues all have very similar patients, Deborah's story is important not just because she represents one of the many patients that have benefited from research and the advances in treatment, but because it offers hope. Hope that is so important for patients and their families, and let me say, doctors and other professionals looking after patients with brain tumours. So when it comes to speaking with patients with tumours, it is nice to be able to look a patient in the eye and give them that genuine hope. And in the future, through the continued work of my colleagues, I look forward not to giving hope, but to providing simple reassurance about the future. I hope that you enjoy this day, and I thank you for the opportunity of speaking with you today. Thank you.